Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cober.
I always kind of start out in the same spot with my guests. Like, no one kind of chooses this path.
Yeah.
Did you from like an early age, did you know you'd be here?
Oh, heck no. Dude, I'm not even sure that at a late age, with the different stuff I've done, that I'm where I need to be.
Yeah.
But I do know where I'm at is we're making a difference, in healthcare. So like the first part of my career, I began, in the technology side of things and did a bunch of sales stuff and then ultimately progressed into operations and then bought and sold companies and said, okay, can make a pretty good living doing this. But being a father.
Now, wait, you're a Denver guy. I thought all tech happened in San Francisco or New York.
Well, I did spend a bunch of time in SoCal.
Okay.
So, raising the family, we actually moved from the Midwest out to SoCal for one of the early internet organizations. Actually, the guys, there are 5 companies that commercialized DARPANET, which is the internet of today. So the 5 ISPs, I happen to be a part of one of those. So I really saw what commercialization of novel technologies. Holy crap. I mean, back then we're like, oh yeah, what can you do? You can do email a little more, right? Who would have thought that it fundamentally would change everything in how we do, right? And once you have the capacity to do things, it's amazing the other opportunities that came up, the other efficiencies that came up, right? Everything from, you go from thinking about like an ISP, an internet service provider, and providing, access and a broadband access. Once people have that enough, then they start to buy more online, and you see the growth of like an Amazon, and then how Amazon displaces in person, right, and makes it so much easier. You go to some of the ride sharing apps, and by the way, you all need less cars and more people need to ride share here. Being a Denver guy, too few mountains and too many people in cars all the time.
Listen, New York has its pros and it has its cons. And I will tell you, you're right about the cons. Like, definitely we could do better with having more bikes on the streets.
Yeah.
But it's also pretty risky riding a bike in New York City.
Dude. Yeah. And there are certain months of the year, it gets even worse.
Yeah.
Yes.
No doubt.
So it's just seeing things from, the what technology did and thinking about, how technology solved a business problem. It wasn't technology for the sake of it. Applying that mindset, and I said, I really want to make the world a better place. I want to make a difference, not just make money. Healthcare continued to stand out because most people say that healthcare technology or the use of technology in healthcare is like 10 to 15 years behind like mainstream business. So something that, is 1/5 of our GDP, that is 10 to 15 years behind. And by the way, 1/5 of our GDP, people are like, yeah, we got the best healthcare in the world. Actually, a majority of the data says that our outcomes are in the bottom third of the world.
And no one believes that. How does AristaMD solve for this?
It's a great question. And I think just to back up one step on the, getting in to see my primary care doc, again, in AristaMD focuses on the senior population. So when we're younger, oftentimes we feel more comfortable taking more risks.
God bless you, by the way, the senior population. I'm almost there, folks. Where's my appointment? God damn it!
From here right up,
right?
As we're younger, we take more risks. We'll search out things on our own, right? And we're kind of comfortable being maybe in the wild, right? Letting to fend for ourselves. As we get older, we're not as much, right? And so the senior population gets the problem just multiplies because if I can't get into my primary care, once I do get into my primary care, I trust my primary care usually because I've worked with them for a period of time. The old Doc Hollywood, right? The primary care spend more time. They know me. I may even, God forbid, get a birthday card,
right,
or get a little call, right? That genuine relationship and that trust that's there. So when my PCP, then I have that says, hey, Keith, I want you to go see, Johnny the ortho, Dr. Johnny the ortho, or, Dr. Susie, the cardiologist. I'm not going to think twice. I'm going to go do that.
Yeah.
But now Dr. Johnny doesn't know much about my history, and Dr. Johnny may not really know my PCP, but it's always kind of who, things went to.
Yeah.
Same with Dr. Susie and the cardiologist. So the PCP is one challenge. What Arista solves for is once I've gotten into my PCP and that PCP needs to do something with me, right? Should the PCP actually send me to see a specialist? So Arista, in a very base form on things, has what's called a peer-to-peer eConsult. So literally, the primary care does a little thing in their EMR. It's not like 50 clicks. It's 1 or 2 clicks. One of our nurses picks up the information on the other end, looks inside the medical record, can find out all the information about, then curates that or gets all that information to one of our specialists. We have, 72 different specialties and a couple hundred specialists that work for us across the country. We're able to get back within a day. Does Keith really need to go see a specialist? So the first thing is, how many of those people that were sent just out of, hey, you kind of have an ouchie over here, your elbow hurt or your knee hurt, or, Keith, you're a dumbass and you tweaked it again skiing, go over here.
Yeah.
Do you really need to, or, are there other methodologies, or is it just waiting, right? So the first is, if we can offload the volume of people that don't need to go to see a specialist and that don't need to see them live, all of a sudden we're creating capacity for the people that do need, the people that have that larger spot in their arm, right? Getting into that dermatologist,
Sure.
Right?
Yeah.
So what we have this first level where we solve for that by doing that behind the scenes, which cuts in half or oftentimes 2/3 of the referrals of primary care referring out to a specialist.
Yeah.
2/3 of those aren't necessary. So let's get the people the right level, the patients the right level of treatment care, and let's make it easy for the PCP. Because if the patient is at the center, which we all agree they should be, if we're not making life easier and better for their caregivers, the system falls apart. And those PCPs are the lowest paid. They have to know everything, like a super broad segment, and then they got to be able to go deep. And so the whole thing is kind of broken. So Arista makes it easy to do this consult behind the scenes. And then let's say that I actually do need to see a specialist, that, the PCP is like, you know what? Got that information back. Yeah, you are one of those third that need to see a specialist.
Yeah.
Okay. Now I still have to go through that physical process of like booking in and getting in, talking to them, playing phone tag. How do I get an actual appointment? Then all the tests, all the back and forth. What we then do at Arista is we do a virtual visit with some of the top specialists. So a patient could have access to the top specialists all under the moniker of their PCP. So it's not having to go to somebody new that they don't trust. It's all a white labeled service that we're doing because we believe in empowering the PCPs with the tools, with the data, so they can have, with the time they have available, the ability to care for and then give them the care teams. So we allow that, and that virtual care then takes things to the next level of who actually, needs to be talking to a specialist. And that specialist then may determine, they have to go in and see somebody.
So what's some of the pushback that you hear, like the naysayers who, you're explaining this model to them for the first time, or maybe it's not the first time, maybe you're 3 or 4 meetings in.
Yeah.
I'm just racking my brain trying to figure out where are the holes in
the
this
friction
plan?
Maybe let's talk about friction points or abrasion points first, right? So first, if a group, if a primary care doc doesn't have, if they have to see 3 to 4 patients an hour, it just doesn't work for us, because even though they want to deliver the best in care, having to change anything in their workflow and doing it consistently, and then the amount of crap that they have to do from documentation to get any type of reimbursement, there isn't the reinforcement mechanisms there. So it's a broken ecosystem. So that's first and foremost. Now, for the docs that are working for these groups who are in value-based care, where they're encouraging spending more time, going back to the relationship side, going back to being proactive, then it's, well, why would I do this? But I'm used to sending, my patients down to, Dr. Johnny, but I've always done it that way.
Right.
Well, okay, so let's look at the data and say, okay, how did Dr. Johnny's outcomes fare? How was the patient satisfied? What was the total cost of care? And docs are the most challenging and the easiest group to work with when you go to change management. Presenting the data is the difference.
Yeah.
So it's saying, let's look at this. You care about the best in care. And yes, you play golf with Dr. Johnny, but that's really not the driver by why you're sending your patients, is it? I mean, come on.
Yeah.
Right. Here's a different way. And then getting a couple of early champions, right? We just need a couple of people like in a new organization working with us. Give us the most outspoken critics. Let us work with them on what could be done differently.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.